Good morning, everyone. Thank you so much for joining us today as Families Together hosts yet another town hall on the many different systems that our children and families are involved in. As many of you know, our children are involved in systems including mental health, addiction, child welfare, juvenile justice, special education, developmental disabilities. So we're hosting town halls throughout the month of February as part of Family Empowerment Month. Today, we are fortunate to have with us the Commissioner from the Office of Children and Family Services, Sheila Poole, and we also have the chairs of the Children and Families Committees in both the Assembly and the Senate. And we have impacted family members and young people to ask questions of these leaders so that everyone out there can hear directly from these leaders on their goals and the work that they're doing in Albany to help our children and families succeed. With that, I'd like to introduce Assemblyman Andrew Hevesi, who's the chair of Children and Families.
Thank you, Paige. It really is an honor to be here. And normally we would be going to Children and Families Commissioner first, but she's having some technical difficulties. As soon as they straighten that out, I'm sure we'll get her up back and running. But I'm Andy Hevesi. I'm the chair of the Children and Families Committee in the State Assembly. And Paige is right. We are going through systematically every one of these systems to see where we are. And the analysis is telling us similar things across all systems, but I'm happy to focus on child welfare today. But it is just an overall perspective, an underfunded system, grossly underfunded, that also, while there are great people who operate it, and they do incredible work every day, the policy structure that set up the system is poorly designed. So we have our work cut out for us in the future for both funding and for making a system that works better for our kids and families in New York State. So Paige, I really thank you for allowing me to be here. Thanks.
Thanks, Assemblyman. We also are going to have with us today, I don't think he's on yet, but our Senator Brizport, who's the chair of Children and Families in the Senate, who's also been a strong ally. And we work closely with both Assemblyman Hevesi and Senator Brizport on many issues, and you're going to hear about some of that today. And also with us today is Commissioner Sheila Poole, who is going to be joining us briefly. But I want to get going with the questions and introducing the moderator and the ambassadors that we're calling them, the family members and young people who have direct lived experience, who can speak specifically about their experiences and how the policy agenda that Families Together has can impact them. So with that, I'm going to introduce Daphne Brown, who is our Deputy Director at Families Together. Daphne?
Hi, everyone. Thank you for joining us today. Less than a year ago, we all got together and we met. And since that time, things have changed. You know, I wanted to recognize the partnerships and the commitment to make sure that families, that children are staying with their relatives and in kinship care, and also the commitment to strengthen families in the child welfare system. You know, we appreciate the partnerships, and we look forward to working with you to make sure that our families have what they need and that our youth are safe and that they're secure in families that can raise them properly and keep them safe. With that being said, I'd like to, I'm looking now. I'd like to have Ruth Rivera unmute yourself and introduce yourself and ask your first question.
Before we do that, I think Sheila is, I think that the commissioner is on now with audio.
I hope I'm back.
You
Can
are.
you hear me? My
Yes.
apologies. I'm so sorry. I'm glad to be with all of you. My apologies.
Thanks. We just wanted to introduce you so that you could address the group.
Sure. So I'll say what I thought I said when I was on mute and we were completely disconnected, which is to say that I'm grateful for the opportunity to be invited back with all of you. I've really enjoyed the invitation and the opportunity to listen to your voices and to the concerns as well as your hopes for a better system. So I'm happy to be with all of you today.
Thank you, Commissioner Poole. And I was just thanking both you and Assemblyman Hevesi for the commitment and the partnerships that that have been created since we met a year ago. and we appreciate it. And I know that our families in New York State will appreciate the changes that they're going to see in the child welfare system. With that being said, I'm going to introduce Ruth Rivera.
Good morning. My name is Ruth Rivera. I work for Families Together, but I'm also a parent with previous child welfare experience. So I'd like to ask a question. From the perspective of a parent, interactions with CPS are laced with fear, information asymmetry, and a stark imbalance of power. Parents enter these high-stakes interactions without knowing their rights and often without anyone available to inform them of their rights, let alone exercise them. What is the state doing to ensure that parents navigating this terrifying process are equipped with knowledge of their rights and access to quality and timely legal representation?
Great question, Ruth. Can you hear me? I just want to make sure, you can. So, obviously it's our, and you're right, that we know that parents fear that knock on the door from Child Protective Services and what can sometimes happen to them. We put a lot of effort at OCFS into, we do train the state's child welfare workforce. We spend a lot of time setting an expectation that, Child Protective Services should be about family engagement, right? That workers, when they enter a family's house, there's no reason, except in very limited circumstances, to show up without having called a family in advance. Being respectful of parents being at work and having other obligations, again, unless it's an imminent risk situation. So our expectation and hope is that when Child Protective Services, whether they're there to do an investigation, or I think you're also aware that we have adopted family assessment response, which is the alternative to a traditional Child Protective Services investigation, where we really want family engagement and where we want families to feel safe that the engagement with Child Protective Services is not going to result in an indication. So that's what really we aspire to. But at the same time, Ruth, we know that for some families, the very thought of seeing county DSS car in front of their home, right? Or, someone from ACS in the city does fill families, with anxiety and with fear. And again, we try through our work here at OCFS to promote a message that family engagement and family safety, go hand in hand. And if you're putting a family on defensive or that they're fearful, they are going to be much less likely to trust you, right, that you're there to really help them. I know that there's a lot of conversations also happening at the federal level, specifically with respect to legal representation for families involved in the child welfare system. So I just want to say two things really quickly on that point. So one is we are able as a state to use our federal Title IV money to support legal representation for families involved in the child welfare system. As it stands right now, it's for families who are post-petition, so where they're already pretty deeply involved in the system. However, recently, I think it was just 2 weeks ago, the Administration for Children and Families posted a notice of public comment that they want to allow $40 to be able to support families pre-petition. So potentially that could open up the door to having legal representation for families at the point of a Child Protective Service investigation. So I think all of that is to say that there is absolute recognition that so many of our families in the child welfare system do not have, right? Many of our families are families of color and in communities, and poverty is everywhere, don't have access to call up an attorney. They can't afford it. And I think there is a recognition that a lack of equal access to quality representation affects outcomes for families. So we're hoping that we can continue to advance our work in that area. And I would also say, if there are things you think we can do here at OCFS, if we could work together on a brochure, right? Sort of families. I mean, we're always open. And if Families Together, or any of you have any ideas about how we could work in partnership while all those other things are happening, I'm happy to do that with you.
Thank you, Commissioner Poole. Assemblyman Hevesi?
Yeah, thank you, Daphne. I appreciate it. And Ruth, I really appreciate the question. And Commissioner and Paige, good to see everybody. And Commissioner, that was a really good answer to a very difficult question. I mean, this is one of the most difficult questions around. And I'm going to be intentionally vague, and I hope that doesn't offend anybody. I'm just going to be, I know the Commissioner's like, I would like to do that. Because this is an issue that is so dicey. We are researching, I believe that people have a constitutional right to legal representation. And we got to figure out how to do that. Also, the system itself, I believe, can be switched to a system where instead of when the workers get involved and get called, instead of looking, providing supports. How about that? When they get called, their first ask is they should be providing supports right off the bat. And if the supports solve the problem, then you walk away. But we don't have that. We have people walking into a situation, and the CPS workers don't have what they need to support the family, in my humble opinion. And therefore, it becomes a punitive system where we are being punitive about poverty, among other things. So there's a lot to unpack here. I will suggest that the Assembly is considering post-budget, which is just a month or two away, doing a hearing on this topic so we can explore this deeper. That's why I'm being vague. But there's a lot of analysis that has to come with this, and I look forward to doing it with you guys together.
Thank you, Assemblyman Hevesi.
Sure.
The next ambassador I'm going to call is Cheyenne. Could you unmute yourself and introduce who you are and ask your question?
Yes, thank you so much, Daphne. Before I start, I would like to say thank you, Commissioner and Assemblyman, for taking the time out to spend with us today. Okay. My name is Cheyenne Dioprasad. I have lived in foster care for 5 years and was lucky enough to find permanency with a family member who cared about me. The reason I feel I was lucky is because I've heard many horror stories from my friends about their time in congregate care. Too many young people grow up in group homes rather than loving families. Young people need families who love, nurture us, and invest into us. On any given day, over 2,300 children are in congregate care, and the poor outcomes do not justify how much money and resources are spent keeping them there and compounding their trauma. A lot of my friends grew up in group homes, and before running away, one girl that I knew said that she begged for a foster family. She begged to be loved. Before running away, she said she begged for a foster family. Anything but another facility. Kids who grew up in group homes experience high rates of homelessness, dropping out of school, mental health issues, drug use, and arrest. We must do better. My question is, what will New York do to ensure that our child welfare system prioritizes families over facilities? Thank you.
Daphne, could I take that one? Or Commissioner, you went first last time. It's your call. Feel free.
Go right ahead, Assemblyman.
Okay, good. Okay, so it's a great question and I appreciate it. So in principle, I agree. And you're seeing, I think, government coming to the reality that we agree with you too. You see it from the federal government with their incentivizing through the Federal's Families First program and Title IV money, exactly what you're talking about, get kids out of congregate care. Now you mentioned 2,300 kids are in congregate care. I want to be specific, and maybe the Commissioner can help me in a second, but there are some kids and congregate care settings that you need, and I want to be careful about these. Those for commercially sexually exploited children, those for kids who have younger kids, and there are some others, or for medical reasons. But you're right, there is a population of kids that in New York State remains in congregate care, and we are actively working with some of your partners here to figure out a bill. It's called the Families Over Facilities Bill, and we are working through it, but it's complicated, and it touches on the courts, it touches on the foster care system, it touches on kinship, it touches on a lack of resources. So we're working on it, but I don't have it yet. When we do, we will move on it. But your friends and I and my colleague and friend, Senator Brisport, and a bunch of our other colleagues are going to be working on that, and we'll bring that to you at some point soon.
So I'll just add to Assemblyman Hevesi's commentary. And first of all, thank you, Cheyenne, for sharing your story, your personal story with me and others today. So a couple of things. You're absolutely right that we have a ways to go in continuing to reduce the number of young people being served in congregate care. You know, that being said, as the Assemblyman referenced, we've made progress. in the past 4 years. I mean, we have, just to give you some statistics that I've studied for my budget hearing with Assemblyman Hevesi last week, so our numbers, the good news is that the numbers of kids in foster care in New York continues to drop. So yes, and that's not true of many other states, unfortunately, because of the pandemic, and they don't have, as much prevention as we do in New York. The numbers are really skyrocketing. So we have about 14,300 children and youth in foster care. As of the end of last year, 84% of the kids in care in New York were in foster or kin foster home settings, which is really substantial progress. But there's a way to go. And there's two things that I want to say that we're doing here soon that I think will really help us attract and recruit more foster parents, right? And kin parents to our system, because that's been a challenge. And frankly, the challenge has been that we have really not modernized our rates of providing board and care and other supports to foster families so that they feel they've got enough capacity to serve children. So the state has recently settled a very, very long lawsuit that was brought against the state around this issue of insufficiency of funds paid. So we will be raising the rates, the foster care and maintenance rates to foster parents, to kinship foster parents, to adoptive parents who receive a subsidy in the state. And it's a substantial increase. So that's coming soon. Local districts will have, because we pass our money through, I think you all know, to local departments of social services. So they will be required to pay the maximum state aid rate, which they're not going to do. So that will help make our system more attractive. The other thing that we're doing, and again, as part of Family First, is looking in that clearinghouse, right, of evidence-based models, looking at ones that really help us further that goal of having young people in the least restrictive setting. And so we are looking to, in 2022, to begin to implement an evidence-based foster boarding home model called multidimensional treatment foster care. So it's been around for many years, but it is a more intensive model, giving support to the young person living in a foster home, and also giving much more support to the foster parents, right? So that they are not asking that Sheila, right, be moved from her foster home because Sheila's acting out her trauma, and a foster parent is not really equipped to understand that. And we see that all too often in foster care. So we are really excited. This thing keeps popping up here and I can't see you. Now I can. We're really excited to begin to, to implement a couple of those initiatives as well. And then the other thing I will say is I'm happy that we have just entered into a contract with Families Together in New York State, who is going to help us bring parent advisors and parent advocates, not only to us here at OCFS, but to social service districts across the state. And again, I think that parent advocacy, that voice, and we're also looking to bring youth advisors closer to local districts so that we can better hear the voice of youth. We've got a lot of other things we're doing on youth voice, but again, using the voice so that we continue to build up supports, right? So young people, to the extent we can, and there will always be a need for some congregate care, but it should be, right, sort of as a last resort and not a first, right? First placement for kids.
Thank you
Thank
so
you,
much.
Commissioner Poole.
Can I jump back in on that, Daphne, if that's okay?
Yeah, go ahead.
Okay, thank you. So I think the commissioner is 100% right. And I love talking to the commissioner because I always find out new stuff that they're doing, which is really great. It's great. And when we first asked the question about families and congregate care, my immediate thought went to the bill, right? It makes sense. I want to tell you about the budget and what we're going for in this year's budget, because it affects it. It doesn't use the same terms. So part of what we will be pushing for in the state assembly, and I believe in the state senate as well, is a bill, I'm sorry, it's a bill called the Children and Families Reinvestment Act. Part of that act, there are several components. One of those components is to raise the amount of money that foster parents get. Another component is to raise the amount of money that kinship parents get. And then I would say the most important thing related to this particular topic is our second ask, which is to take the kin gap program and move it out of the foster care block grant. And now by doing that, you do two things. And I've mentioned this to the commissioner. And again, thank you to the commissioner. They did settle, and they're looking to modernize our rates for the MSAR, which we really do appreciate. We're going to be looking to help those counties, because I believe the court settlement says that the counties have to pick up the rest of the cost. And we're coming off a decade where the counties have really been under assault from the state. So I think we need to help those counties, give them money. There's a variety of ways to do that, but one of the ways is to move the kin gap program outside of the foster care block grant, number one, so the kin gap program can grow on its own, uncapped. And then as for the foster care block grant, by moving kin gap out, that saves money, which I think, Commissioner, maybe the counties could consider using to help cover some costs for the MSAR rates. So we're thinking about these things together. We're working in cooperation with Commissioner Poole consistently, and I love that, and I thank her and her team for that. But there are a couple different ways we're going to go out of making sure that kids are not in these facilities.
Thank you, Assemblyman Hevesi.
Sure.
So the next ambassador that I'm going to call is Kim Kaiser. Can you unmute and introduce yourself?
Thank you, Daphne, and thank you, Assemblyman Hevesi and Commissioner Poole, for being here today. Really grateful. So I echo the sentiments of the former ambassadors in that. I have a question, and I'm coming to you as a parent, but not as a parent who has had this experience, but as somebody who has worked within this system and has been doing this work for close to 40 years. I am a former CPS worker, and I'm also a former advocate to help implement these changes. I have a view from within the belly of the beast, as well as a view from the outside, coming to you as a woman of color and seeing and knowing the impact that this system has had on our community. Because historically, we know the child health welfare system has marginalized Black and Brown and Indigenous people and poor families under the banner of protection. But at the same time, they failed to recognize the humanity of struggling families who need help. They have failed to exercise cultural humility in this and an understanding. So after decades, we know that the outcomes produced have demonstrated severe biases in these systems. When are we going to work to build a solid safety net that will support the entire family's well-being and collaborates with other state systems? We have a one-size-fits-all, and humans are like an onion. You have to peel back those layers to find out that somebody's just not child welfare because of A, B, or C reason that the system has crafted. You have children who are cognitively disabled, who are mentally ill. You have their parents who are dealing with things. And in the cases of the communities I'm talking about, you're talking about intergenerational historical trauma and extreme fear of systems. And at the top of that list is the child welfare system. Many families are calling for mandated supporting and not reporting. So how are we going to build a continuum of preventive services and resources that will shift the focus, engage in a serious, drastic culture shift from being punitive and punishing families to supporting their well-being?
I'm happy to jump right in on that, Assemblyman. You're
Feel free.
Kim, what you articulated it so beautifully and powerfully, and you're right about it all. So we have been spending a lot of time here, and I wish Lisa Gartio-Gandimu, who's my deputy for child welfare, next year. We'll definitely have Lisa join. Lisa is a woman of color herself, and I am very fortunate, you know, as a white woman leading an agency, right, that we do child welfare, we do child care, we run the state's juvenile justice system. I have a very diverse senior team here, and as we should, given the work that we do. So we are 100% committed and not just talk, but action. So I wanted to just share with all of you, which that's why I like these opportunities. And I say this to Assemblyman Hevesi too, like the budget hearing does not allow commissioners to ever tell all the work that's actually going on to try and promote some of these ideas. So we're trying very hard to do exactly what you said, which is to prevent families or mandated reportings from having to call in families to our hotline in the first instance. 57% of our indicated reports, right, in New York State called into the hotline and indicated are for maltreatment. They are not abuse cases. They're generally cases where there is a family who have not had access to something, either a commodity, a good, or a service, right? And so we're pulling them into the system before we give them help. So I wanted just to lift up a couple of very, very specific initiatives that we are working on. And then I want to, I'll go quickly too, but I have a lot to say. And I want to also, Kim, get back to your point about the cross-agency work, because it is absolutely true. It is hard to do, but I am telling you, we spend probably 30% of our time here at OCFS on Zoom meetings and calls with the commissioner of OMH, the commissioner of the state education department, the new commissioner of the Office of People with Developmental Disabilities. We have a new commissioner at the Office of Temporary Disability Assistance, right? An anti-poverty agency. How do we work on that together? And we've got a new terrific commissioner, Dr. Cunningham, leading up our addiction services agency. OCFS will never be able to do this together, right? So I'll just start backwards. One example that we're working on, so we're going to be releasing an RFP soon. So this will be a sort of a jointly funded RFP between my agency, between OMH, DCJS, Criminal Justice Services, Commissioner Rosano, which I think she was on one of your panels. So it's OCFS, DCJS, OMH, who am I forgetting? And SED. So everyone's putting their, right, $20, it's more than that, into the pool. And we're going to release an RFP to stand up be called Family Opportunity Centers. So we know that the schools, right, are a big source of mandated reporting, right? So when we talk to teachers though, and you talk to superintendents, they have real concerns about some children and families. They see kids, right? They see families struggling with things and they don't feel like they've got a way to get help to families. So what do? They call the SCR hotline. So these family opportunity centers that will be in this RFP can be embedded in schools. That's a preferred place, right? Sort of with family advocates who have access to real resources so that when there is a family or a concern that we could do a much better job in the moment supporting families. So that is one, I think, very powerful example of 4 state agencies coming together, pooling money in support of families and particularly of schools as well, where we see so many reports generated. There's a couple of other things we're also doing. So I don't know if any of you are familiar with the care portal model, right? So care portals have really come out of the faith-based community. So there's not a lot of questions asked. Family says, I need a gift card. I need help with school supplies. My washer machine is broken, right? These are all the things that families often don't know who to turn to, right? So we are OCFS we're partnering with an IT firm and with Care Portal to be able to allow Care Portal to be available for caseworkers and for others who are working in our system on behalf of families, so that when they see a family, to Assemblyman's point earlier, right, that worker can provide this access to supports to those families. So that is something we're also rolling out. I taught you about the peer and family advocates. I told you about our family opportunity centers. We are also piloting mobile crisis vans So this is a partnership with the Office of Mental Health. We're piloting this in Albany County and Monroe, Onondaga, and Westchester. So we have, we've bought these Winnebagos, and they are being retrofitted to allow support teams to be able to be responsive to parents and mostly trying to get at some of our rural communities where families have even less access to services. So being able to help serve those areas, we're partnering with OMH because we want to bring better supports, knowing the mental health stress that the pandemic has created. So we're really excited about being able to sort of help stabilize and bring more supports to families in ways that we haven't done. We're also, and super excited, I think we're the only state in the country right now. So for child welfare, we're going to be piloting a basic income, guaranteed income model. So we're going to use this with families in the child welfare system who are experiencing family assessment response. We're working with the University of Pennsylvania, who's done all the research on the universal basic models. Super excited. That's going to start happening this year. We are also working on creating a warm line as opposed to just our hotline, as it's often referred to. So we want to establish a phone line that we can proactively offer support to families that they could call and say, look, I'm really having a hard time, a safe place that they can call and ask for some support. So we're working on scripts for operators to be able to respond to that. Just all kinds of things, right? So hopefully you're getting the idea that we are all about let's use whatever money and funds we have to get way upstream on prevention in ways we haven't done before. I will also just make an editorial comment that we would also love it if the Family First legislation allowed $40 for prevention to be used in these kinds of things that are not necessarily all evidence-based, but as you all know, Families First is pretty limited in that respect. So we talk to the feds about that all the time. They're tired of us, but that's really the sweet spot for the future of upstream prevention.
And Commissioner, thank you. I want to put in a plug for the voices and the lenses of lived experience.
Absolutely.
That's it. That is one of the most important things. Focus on those communities most impacted and those individuals with lived experience from those communities to help inform and improve and sustain this awesome stuff that you plan on doing. Thank you so much.
Thank you, Commissioner. Assemblyman Hevesi, did you want to comment?
Yeah, if I can, because there's a lot there. So first, thank you for the question, Kim. I really appreciate it. And Commissioner, the list of things that you guys are doing is really incredible. And I do want to say thank you to them because there's a sharp distinction in my mind from the last couple of years on these topics in prevention. So thank you to Governor Hochul and the Commissioner. And I do want to suggest two big picture thoughts on this topic, Kim. Number one is, the state has been systematically underinvesting in trauma prevention for years. We are legally required to refund counties at the 65-35 reimbursement rate for preventative services. We've been violating the law for years. We've been reimbursing at the tune of 62-38, which cuts money to counties and then causes budget crunches for them. So we're not providing as many prevention services. So from the legislatures, the Assembly's perspective, I want to be careful because I know Senator Brisboard is here. I don't want to speak for the Senate. He's going to do that in 1 second. First of all, good morning, Senator. Good to see you. And so we're going to be pushing to put money in the system. But then again, I'm going to come back to the hearing post-budget, because so the commissioner's right, they're working on a lot of things, but here's my big picture problem, if I can. And you tell me if you think I'm right or wrong. And I don't have lived experience and I'm not the expert, but I feel like it's an offensive government structure, just the structure, not the people. Like they're good people, but the structure is offensive. So you have a government structure that doesn't provide opportunities for people to sustain themselves, right? Then the crises happen, government gets called in, and they come in and it's a threat. It's a threat. It's not, hey, a helping hand come in to help you. It's, you're not doing this right. And the threat is of an ACE. It's an adverse childhood experience, because what you're ultimately threatening is we're going to take your kid away, man, which is the worst thing any parent can have. And the worst thing for the kid, I mean, I don't think there's a worse ACE than that. So we understand there's a need for it. And we understand why the system is working this way. But I don't think it's well thought out in its inception. So I think we need to, at some point, look at the whole thing and say, what do we do in big picture here? I don't think this is the best way to handle it. But in the meantime, you got to invest and you got to do all the things that the commissioner is telling you that they are already actively engaged in. So thanks.
Thank you, Senator Hevesi. Assemblyman Hevesi. I wanted to see if Senator Bridgeport wanted to introduce herself to the group.
Hi, everyone. This is State Senator Jabari Brisport, Chair of the Children and Families Committee in the New York State Senate. My apologies for coming late. I did miss the question, but I'm happy to chat more about proposals and thoughts for the children of our.
He froze. Okay. Maybe he can come back on. Yeah. Okay. So I wanted to just check in. Did Jeanette make it to the town hall? Jeanette, okay. So I'm gonna ask the last question. Can you guys stay on for a few more minutes, like 11:50, 11:52? Okay.
Sure.
All right. So one of the questions, so New York City has implemented family support in the foster care agencies. And some of the issues that are happening in New York City, which I hope don't happen with the rest of the state, is that families are being referred to as drug addicts. What else did she say? Drug addicts, but basically they're referred to as their problem. So what are we doing to provide the staff that interact with these families? How do we do a culture shift to change their interactions to strength-based interactions, and to recognize people as human beings and that people are not their mistakes? Because we have to shift the culture, because if you don't view me well, then what is your level of involvement and engagement with me if you really think I am my mistake? And I heard you say something about the training center. Are we bringing in family driven? Are we bringing in strength-based training so that people can start to look at people as humans that just made a bad decision and a mistake?
Yeah, I hate to hear that, that any caseworker is speaking to a family, calling someone, a drug addict, or you're never going to get your child back. I think you all know we don't train that. That's just completely unacceptable. And there's always room for improvement on how we train the child welfare workforce. What I would say is two things: that OCFS, and I'd love for some of you to come and visit our training center at some point. It is, I know, I think Paige and maybe Brad and Assemblyman Hevesi, and I don't know if you've ever seen our Human Services Training Center. Like many things, COVID put a wrinkle in our plans, but so we've got this 100,000 square foot training center. And the whole idea of why we made such a huge investment is that we know training caseworkers sort of sitting in a classroom, reading manuals and materials, it's not the right transfer of learning, right? So what we built in our training center is a whole, we call it Simulation Alley. And it is a whole section of our training center that contains, it looks like a street in New York City. And it contains apartments that are used for caseworkers to go in and to practice the skills that we're teaching them in the classroom. So to knock on a family's door, how do you begin that conversation and say you're there from Child Protective Services? We change the scenarios in the apartments. So if there are dirty diapers, or there is drug paraphernalia, we're trying to do a better job using real life experiences that caseworkers find themselves in, but doing it in a way that they learn and practice and get feedback from our trainers about how to do it in a family engaging way, to ask open-ended questions, to not put parents, on the defensive. So again, with COVID, we had to go offline, we had to do it virtually, but we are now getting folks from all the counties back into the training center. I would love for you to come and see it. And anytime, and again, this is sort of our evolution at OCFS on bringing in our parent policy advisors, bringing in young people to review the trainings that we're doing to county staff who are independent living coordinators, bringing young people in when we're doing foster parent training, so that young people have the opportunity with lived experience to talk about what it felt like when they were treated differently in a foster home, right, than a family's other kids. So we're really trying. I mean, there's always more work to be done. I know that ACS has their own, training center that they've made an investment in, or using simulations as well, again, to try and, help workers understand that they are there to help families, right? That an investigation in and of itself is a failure, right? Getting families feeling safe and getting them connected to real help. That's what the system outcomes should be about. And so anyway, anytime you want to come and visit, I would love to have you. And I'd love to, you can sit in and watch some of the trainings and the simulations and give some of your feedback as well. I think we'd welcome that opportunity.
Thank you. I've actually seen it, and you're right. It's designed after a house and a living situation. So we would love to come in and sit. And
Yeah.
I think the main thing is just recognizing that people are humans, and there's got to be a culture shift in child welfare that wants to support rather than hinder families. And we want families to trust the worker that is coming to their house, that they're going to do what they need to do to help this family keep this parent to keep their family intact. So that's the important message. I wanted to
Stephanie, can I just say one final thing too? I have to say this because I think and I ran the local child protective system in Albany County before I came here. So we were right on the ground, right? I would go out with caseworkers and do joint home visits with them, for sort of quality assurance. We also have to remember that they have one of the most difficult jobs there is to be done. They are not treated with the same respect and dignity as other sort of first responders are. And I, from my own personal experience, there are some amazing caseworkers out there who every day go out there and do their best and do engage families and do work with families in that way. So I think we have to be careful not to cast the entire system, right, as not being in support of families, because I don't think that's a fair representation.
Right. I don't either. So you're correct. And we are happy to partner with the amazing caseworkers and the ones that will become amazing. So
right.
Yes.
Well, and I just wanted to also acknowledge to the Assemblyman and the Senator, the Commissioner mentioned the family policy advisors that we're going to be Families Together is going to be working with OCFS to hire, and they will serve as ambassadors really at the OCFS offices, and that trickle down of including the, at least paying attention to the biases that Kim described in her question. There's implicit bias that all of us need to overcome. And the best way to do that is to have exposure to the very people that you have biases. And so the families being involved in those offices, the way that OCFS is proposing is just fantastic. And we're so excited to be working with them on that. Senator,
can I jump in and then let the senator finish? I want to set him up. That's what I'm trying to do, Paige. Is that cool? Can I set up the senator? Okay. So on two fronts, the senator and I have engaged on this topic a little bit. So number one, we both passed a bill out recently that outlawed in the law the use of the phrase incorrigible for young girls. incorrigible was written into the law, meaning a girl that just didn't listen. It was an outrage. So we passed that recently. So we're cognizant of that. But then I think you hit on the other point, and this is where I'm going to set up with the senator. The senator and I also, and thank you to Commissioner Poole and the governor, we also put in implicit bias training for mandated reporters in this year's budget. And this is a system, and that's not the end of it, because one of the big problems with child welfare, and Senator, I'm going to leave it to you here, is I think one of the big problems is it's just rife with implicit bias and race issues. And it's not just from white people to black people, it's black people to black people. There's problems all over this place, and we need to be really careful about how we construct the new, better way we do this to account for that. So Senator, I'm sorry, I'm done. It's all you, my friend.
Yeah, no, I really appreciate the conversation. Sorry for my technical difficulties. My phone's just, it's not having it today, but I really appreciate being part of this incredible team with Assemblyman Hevesi and Commissioner Poole and some of the great advocate groups that are on this call. And thank you to all of you that are tuning in. Truly, I really do appreciate hearing all the initiatives that we're all working together, whether they're coming from the Office of Children and Family Services or from the respective offices of Assemblymember Hevesi or my office. I do want to hone in on a few things. One being just reiterating the notion of prevention before things even happen. Like the commissioner said, if you're under an investigation, then that's already a failure on the part of us in government. And I think the mobile crisis vans are a great example of that, because I support mobile crisis vans and I think they're incredibly important, and would also like to build a world in which mobile crisis vans are not necessary. We have an entire national conversation going on right now around crime and policing. And one thing I've been talking about with people in my community is, how do we deal with these adverse childhood experiences in advance? Because, I have members of my community that, that they have an experience or a form of trauma when they're 5, 6, 7, 8 years old. And then 10 years later, they're picking up a gun. And how do we fix these things 10 years in advance? So just reiterating things that the Assemblyman said, really the 65-35 reimbursement is absolutely critical. I mean, the more money, I feel like we should push even further, but let's start with following the law. So, the more money we put into prevention at the outset is good. And I want to add in, I believe, parental rights and the knowledge of their rights has come up before. I didn't hear how much conversation came around the Miranda bill, but I do carry it in the Senate. There are racial discrepancies in terms of how and when children are separated from their families, and I do believe that's tied to we have a situation where there are racial discrepancies in who's aware of their rights, and I think that if people have rights, they should know about them. But it is an ongoing conversation. But truthfully, as we are in budget season right now, the notion of money cannot be said enough. And programs like the ones you've been hearing about today, they're the right thing to do, but then just from an economic common sense perspective, they save us money in the long run. And it's great to be working and be in conversation with my partners in government and all of you who are in the advocacy space.
Thank you, Senator Brisport. So we're at 11:54. I don't know if anybody has any final comments that they'd like to share before we close out the Child Welfare Town Hall. Okay, so I guess I'll do it. So thank you, Assemblyman and Senator and Commissioner, for joining us today. It sounds really good that we're all working towards a system that will help families before they get in trouble. And if they are in trouble, that we're supporting them through the process, and that we're trying to keep families in communities and in their homes where they belong with parents that love and support them. So we appreciate the partnerships. We appreciate what you're doing with us to make this happen. And we look forward to seeing you next year on the Town Hall, maybe in person. We look forward to coming to the training center.
Yes.
And we look forward to partnering with you to try to make sure that we are responding to parents and we're not scaring them. Okay?
Thank you all so much.
Thank you,
Thank
everyone.
you.
Thank
for
you.
having me.
Thank you, Senator.
Okay.